Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not had a chance yet to subscribe, I would very much appreciate you supporting this channel because not only are you helping me, but you are helping so many others find this content. So I would very much appreciate your subscription. If you like this video, comment, all of those things tremendously help YouTube algorithm. For today, I want to discuss with you what is trans enough. Is there even such a thing as trans enough? What does that even mean? Where does that idea even comes from? I want to discuss this because I still have people reach out to me and ask me um, things such as, and most importantly, specifically things such as, Dr. D, I am not ready yet to start hormonal transition, or I'm not ready to be out yet, or maybe I am on hormones and I have no desire whatsoever for, let's say, genital surgery. Does that mean I'm not trans enough? Does that mean that I am not valid? This idea of tying trans identity to some elements of surgical transition. And if you are not stepping in any elements of transition, you're not trans enough. I'm laughing because I think it's a really ridiculous idea. So let's break it down a little bit here, shall we? So first of all, trans stands short for transgender, right? And transgender, trans, and then whatever else you may add to that, transmasculine, transfeminine, transfemme, transmasc, trans, even non-binary. They're all ways of defining one's relationship to their genders. They're all the ways that we use to describe, to connote, to communicate our gender identity. The same thing with cisgender or a person with cisgender history, whichever way you want to talk about it, is a way to communicate to another person one's relationship to their gender identity. And there is ways to identify. There's gender identity, right? There's the way we feel about ourselves. There is this inner, deep felt sense of how we see ourselves. And then there is gender dysphoria. Gender dysphoria is a psychological phenomenon. Gender dysphoria is, really simply put, it's a distress signal that one experiences when there is an incongruency between your gender identity, how you feel about your gender, and your assigned gender. As a result of this incongruency, you experience gender dysphoria. A lot of times, in my experience, people seek out gender transition, aspects of gender transition, whether it is social, medical, surgical, legal, or any other spiritual, because gender dysphoria is producing distress, it is painful, it is uncomfortable, and so individual seeks those services, which we call treatment, as a way to alleviate, to diminish, or to remove altogether the distress one feels. Certainly, there's people who step into gender transition services without feeling the distress. Okay. And those people may say they've done it because of euphoria and not dysphoria, or just because it feels more right to them. My expertise, my field of expertise lies in gender dysphoria, in distress, and in numerous ways one can alleviate the distress one feels. And my expertise also lies in gender identity. So when we talk about trans enough, essentially what we're saying is your identity, the way you relate to gender is in some shape or form or capacity is not enough. It's not enough implies that there is a set way to define and describe one's felt sense of gender, which, if you think about it, is impossible, because we're talking about not only individualistic aspects of relationship to their gender, which are very person-centric and revolve around your specific experiences, revolve around your your culture, your socialization, revolve around your upbringing, revolve around your traumas, revolve around so many things. So there's not only they're person-centric, but one sense of how they identify in regard to their gender is also a subjective relationship. And for that reason, it's not something that can be boxed up, labeled, and defined. It can be generally, it can have generalities to it. For example, we all know that trans or transgender, one shape or form, talks about an individual who is not comfortable with their assigned gender, right? Well, that's a very general report. But further from that, it is impossible to pigeonhole what trans identity is. And for that reason, saying somebody's not trans enough it's ridiculous. It makes absolutely no sense. People, a lot of times, create their own policing within certain communities. Trans community is no exception. Within societies and cultures, there's always been policing and gatekeepings. There have always been walls that one has to climb. And there's always a reason for those walls. And one of the main reasons for gatekeeping and policing and walls is to exclude. It's to exclude, and oftentimes the reason behind the exclusion is hierarchy. I'm better, you're worse, right? So you're not trans enough creates a hierarchy. Trans enough is a hierarchy because if you're not going through surgical medical transition, if you're not going through actively transition, then you're not trans. See, I'm going through all the things, so I'm better than you. It's a hierarchy of better, worse, the other pointing fingers, whichever way you want to look at it. And people create this hierarchy again for numerous reasons. One of them is because they want to feel better about themselves. Or maybe they want to be justified in their decisions. Or maybe there's some other reasons behind it. So when people in trans community say you're not trans enough, one of the things they're implying is that trans means you have to go through gender transition. If you're not trans. Which again, I've spoken about so many times on my channel. It is absolutely not true and excludes not only people who are not defined by surgical and medical transition. Again, those are treatment aspects of helping alleviate gender dysphoria. They are not one and the same in regard to trans identity. Being trans does not equal medical surgical. Medical and surgical is something a person decides to step into because it aligns with their goals. Some of their goals could be to feel more confident in their body. Another goal could be to alleviate dysphoria. Another goal could be because it gives them sex characteristics of a gender that they're aligned to. There's numerous goals. That's what the surgical medical is there for. Surgical and medical does not equal a person as trans. Not to mention, let's talk about some of the surgical and medical procedures. Facial feminization surgery. Do you know how many cis people get facial feminization enhancement surgeries? Does it mean that they're trans? So you see, once we start talking about it, it becomes even more silly and ridiculous. The idea behind the concept of somebody's not trans enough is also an idea of invalidating somebody's truth, somebody's reality, somebody's relationship to themselves. It's the same idea, in my opinion, as somebody saying you're not a woman until you have bodily functions of menstruation, being able to give birth, which is a ridiculous concept. It reduces, again, a personal felt sense to just particular aspects. And in this case, it's reducing somebody's gender identity to surgical medical elements. I've seen so many people who write to me who feel like they can't stop or join support groups or be part of trans community because they are either not in a place of their life where they're ready for services, or those gender services are not part of their plan, or there are circumstances preventing them from getting the services, or any other reasons. And they feel like if they're not doing everything else other people are doing, they're less than. Well, you're not. If you're watching this and you're in the shoes, you're not. Again, trans identity is your innate sense. Trans identity is simply identity that means a person has diverged. They have moved away from their gender that was assigned. Their gender assigned was not something that they felt congruent with. And you could have felt that in childhood, you could have felt it during puberty, you could have realized it later in adulthood. You could have spent majority of your lifetime being comfortable with your assigned gender and then suddenly decided that you no longer feel aligned to it and stepped into trans identity. Again, transgender identity is a huge umbrella term for a gender identity. Again, it's your innate felt sense. There's no such thing as trans enough. It doesn't exist. People who say there is such thing as trans enough are creating their own boxes that are conjured from their own projections and their own limitations. And when it comes to identity, any identity, and most of all gender identity, there are no boxes. It's impossible to box because we're all individual, and as individuals, we're all different and we stem from different experiences. Comment below, let me know if you have experienced pushback from the community saying you're not trans enough. How did that make you feel? What are your thoughts about the concept of trans enough? What are your thoughts about this concept that you have to go through surgical medical to identify as transgender? Comment below, let me know. Love reading all of your comments, and I will see you all next time. Goodbye.